you very much. And I think Debbie had made my talk very easy for me because he has shown a lot of things that we are going to see in my slide. This is a muscle study. It's one of our studies in the Gambia with our partners in South Africa. Windy and Mark are actually part of our study. But for the purpose of this presentation today, we will focus on the data from Gambia. Mark and the team had just started recruiting in South Africa. We would not get into that data. So for some reason it's not working. Okay, by way of introduction, Debbie, like I said, Debbie had actually small shed light on the prevalence of muscle in the world and also in Africa. But there is a very limited resources in, data on muscle in Africa. So muscle is a chronic and a progressive hepatic disorder that is diagnosed with the presence of hepatic steatosis alongside at least with one of the cardiometabolic risk factors. These are the cardiometabolic risk factors that you can see on the slide there. So in the Gambia, actually, and every other African country, we know that there is actually our westernization of our diets actually are becoming very much increased, and due to that, we are seeing a lot of diabetes, hypertension, and other non-communicable diseases actually that are actually risks to metabolic fatty liver disease or metabolic steatosis as disease. So looking at the global picture of fatty liver disease or metabolic steatosis liver disease, it actually shows that about 30% of the world population are actually affected by muscle. But also you looked at muscle as one of the leading causes of chronic liver disease, and it also has a strong link with metabolic dysfunction. If you looked at the map, like Wendy showed, Africa actually seems to have no data actually at all as far as muscle is concerned. So if you look at the background in Africa, like I just mentioned, there is really a very scarce data on muscle, and then the disorder is actually increasing in sub-Saharan Africa. So there is a need for us to actually look out for studies to pull out this data. But also there was a pool prevalence study actually that shows that sub-Saharan Africa is about 11.1% to 23%. Also, obesity is on the rise in sub-Saharan Africa. Diabetics is actually projected to increase by 156% by 2045. So which is actually scary. I think it's really coming, and we should prepare for it. A pool prevalence also shows that in hypertensive population, about 30%, there's about 95% confident interval. So but this was a study actually done by some of us actually in the room here. Wendy is one of those people. So what we did in the Gambia is actually the MedLife study. We actually looked at individuals with diabetes presenting to our outpatient clinic, hypertension, and then also obesity and overweight, where we actually consecutively select these patients and then screen them for muscle. We will use, we collect some data like anthropometric measurement, also social demographic, as well as their dietary profile as well. We also looked at that. We collect some blood samples, urine, rectal swabs. This is just to actually look at the microbiome, but this analysis will be done in the future because we are not currently analyzing it. The sample will be sent later to Imperial to do this analysis. But what we do, we do an ultrasound also as well as a fibro scan. And then this will be done actually in our liver clinic. We will actually get the patients from the outpatient and refer them, those that are interested in be part of the study. So what our primary endpoint of the study was actually to look at the proportion of muscle defined by a CAP score of greater than 248. And then secondary endpoint was actually to look at the advanced liver fibrosis defined by liver stiffness measurement greater than 8 and associated factors with muscle and fibrosis. So for the period of review, we started the study from the 5th of November to the 21st of August. That's the data that we are currently looking at. We screen about 256 patients at the liver clinic. Actually, among those people, we excluded 3 of them that actually have some exclusion criteria, as well as due to their severity of the disease, or they had type 1 diabetes, but one of them actually was not able to provide consent, and then one of them was also excluded because of the missing data. So we were able to analyze actually 242 that actually met the eligibility criteria, and then out of these actually we had about 119 that actually had muscle based on the CAP score. So when we looked at this data here, it shows that actually about 46.7% were diagnosed with muscle. And it's important to point out that about 14 of those people, which is 12.4%, had advanced fibrosis, but 2 among them also actually had developed actually what we call cirrhosis. Their liver stiffness measurement were actually 38 and also 38.8 actually. They both shown to actually have fibrosis from this study. But also I want to highlight that actually there was no significant difference between the patients that had surface antigen positive and those that are actually with both in the muscle and then the non-muscle group. But you could see also the hip circumference as well as the waist circumference, BMI, actually is shown to be very significant in terms of predicting muscle. We've also looked at the lifestyle, like I mentioned earlier, and it shows that actually no regular exercise or physical activity was also shown to be very significant as far as muscle is concerned. So the independent predictors actually that are associated with muscle, like I mentioned earlier, BMI and then the weight ratio also shown that actually had some very important or significant association. So this is also important also for us to take note. Diet is also very important as far as muscle is concerned. So we all know in Africa, diagnostic is actually a problem, especially access to probably FibroScan or ultrasound scan. In our setting, it could be challenging. So we were trying to use combining both the BMI and also waist and hips ratio to see if we can actually predict diagnosis of muscle. But this is actually not shown to be very significant when you combine the 2. So looking at the results that we found, actually, muscle was shown to be really prevalent in our cohort. And actually, out of these people, like I mentioned earlier, about 12% of them actually had liver fibrosis, irrespective of their HBV infection. BMI and then waist circumference were also strong independent predictors of muscle and could be used for screening patients at low cost for muscle. But the accuracy result was limited to CAP technology. So we have to think about probably other means of actually, in a low resource setting, how we could actually predict the diagnosis of muscle without FibroScan and BMI ultrasound scan. But in conclusion, actually, we would say that muscle is an emerging major health issue in sub-Saharan Africa, and integrating its screening in diabetes or cardiometabolic clinics, it's going to be very essential in order to pick these diagnoses. And scaling up the longitudinal and intervention study also would be something that we should look forward to. And also policy engagement as well as preventive strategy also would be quite essential for the management of muscle in our population. And then on that note, I would like to extend our thanks and appreciation to the members of the team, but as well as our colleagues in South Africa and also the whole Prolifica team as well. Thank you very much.